All right, last one. We're now going to talk about blood thinners. Did you know there's a difference between anticoagulants and antiplatelets? Let's get into it. The first anticoagulant we're going to talk about is heparin. This inhibits clot formation. Heparin specifically binds with antithrombin 3, which inactivates thrombin and also inhibits the conversion of fibrinogen. It's rapid acting, so it's a great first-line choice for someone who comes in with a pulmonary embolus or DVT. It is poorly absorbed in the gut, so it's always given IV or sub-Q. And remember, we do have to monitor how much we're giving. So we monitor a lab called a partial thromboplastin time, or a PTT. We can also monitor something called an activated partial thromboplastin time, called an APTT. What do you think the biggest adverse effect is? Well, of course, it's hemorrhaging. But did you know it can also decrease the platelet count? And we call this disorder HIT, heparin-induced thrombocytopenia. There's some really smart people out there, and one somebody developed something called low molecular weight heparin. And this actually has a lower risk of bleeding than heparin itself. Do you know what this medication is? You should. You've been giving it at the peaks. It's enoxaparin. Just be careful when giving either one of these medications because, again, they can all cause bleeding. So please look for bleeding and ask the patient if he or she has had black stools, hemoptysis, or any other signs of bleeding. Yes, yes, there is an antidote for heparin, and it's called protamine sulfate. So, after a person has been diagnosed with, let's say, a DVT, a person will be immediately started on heparin or enoxaparin. At the same time, a medication called warfarin will also be started. Warfarin is called a vitamin K antagonist. Yes, that's right, folks. It antagonizes little old vitamin K in order to thin the blood. Did you know that warfarin is used in rat poison? So don't be surprised if a patient jokingly states that he's taken rat poison. So why are both heparin and warfarin started at the same time? Well, it's really simple. It takes several days for warfarin to reach a therapeutic level in the bloodstream. And we do monitor therapeutic levels with warfarin, and we use a lab called a prothrombin time, which is a PT, or an INR. And an INR is used to report the PT. The therapeutic range for a DVT is an INR of 2 to 3. Warfarin must be monitored at least monthly for the rest of someone's life or until they stop taking warfarin. So that is one of the major teaching points when somebody's being discharged on this medication. So again, please monitor for bleeding and have the patient report signs of bleeding. Also, a patient must be careful with ingesting vitamin K containing foods like green leafy veggies. The old school thought on diet and warfarin is for a patient to never eat these foods, but now we counsel patients that they can eat them. We just want them to eat them on a regular schedule so that way we can adjust the warfarin dosage accordingly to what they eat. Remember, there are plenty of drug-drug interactions, and the only over-the-counter pain reliever they can take is acetaminophen. Oh yeah, what's the antidote for bleeding with warfarin? I'll tell you in a minute. On to antiplatelets. So medications like heparin and warfarin prevent clots in the venous system. Antiplatelets prevent clots from forming in the arterial system. We use these drugs to inhibit platelet aggregation and to prevent heart attack and stroke. Aspirin is the antiplatelet that is over the counter and has been proven to be effective. It's also cheap. The other antiplatelet we'll discuss here is called clopidogrel, aka Plavix. When I describe this medication to a patient, I generally refer to it as a high-powered aspirin. You will see patients sometimes taking both aspirin and clopidogrel, especially after they've had a heart attack or a stent placement. Here's the deal with these medications. They must be stopped 7 days prior to any invasive procedure because they are an irreversible antiplatelet drug and they have a very prolonged effect. Yes, it takes that long to get both aspirin and clopidogrel out of your system. And yes, of course, bleeding is the major adverse effect of both. But with Plavix too, there are many drug interactions, especially with the common over-the-counter acid reducer called omeprazole. So please teach your patients these things as they are very important. And you can find more information on page 588 in your textbook. Now take a time to create drug cards for the following: heparin, enoxaparin, warfarin, and clopidogrel. Oh, did anybody ever find out the antidote for warfarin? Well, it's vitamin K.